So now at 1 o'clock, we are going to talk about Better Together, TNVR, and public health with Dr. Bob Weedon. Bob is currently a feral cat surgeon working and volunteering with TLC PetSnip Incorporated in Lakeland, Florida. Kristen and I had the opportunity of visiting TLC PetSnip, way back in 2019. And it was a lot of fun. It was great. And we had a great time. Not 2019, I apologize, 2020, we did that. Having retired in 2018 as a clinical assistant professor and service head of shelter medicine at the University of Illinois College of Veterinary Medicine, where he trained veterinary students in high quality, high volume spay-neuter techniques. Prior to going to Illinois, Bob was the senior partner of a 9-doctor, 2-location small animal practice in Wilmington, North Carolina. As an advocate for solving the problem of animal overpopulation, particularly that of community cats, Bob volunteered with Friends of Felines, a group that surgically sterilized cats in the Wilmington community, and was a volunteer surgeon at the on-site spay-neuter facility at New Hanover County, North Carolina Animal Control Services, where animals were surgically sterilized prior to adoption. Bob served as the veterinarian on the New Hanover County Board of Health for 6 years and was a member of the Animal Control Services Advisory Committee, and he served on the board of directors of the Public Health Foundation of New Hanover County and the UNC Public Health Foundation Board. Bob is the co-author of the chapter on rabies in the textbook Infectious Disease Management in Animal Shelters, 2nd edition, and co-author of 2 chapters in the recently published textbook High Quality, High Volume Spay, Neuter, and Other Shelter Surgeries. Bob attended Purdue University, where he received his Bachelor of Science in Animal Science and his Doctor of Veterinary Medicine degrees. He received his Master's of Public Health from the University of North Carolina, Chapel Hill. Welcome, Bob, and we're looking forward to your presentation.
Thank you, Stacy. I hope you can hear me okay and see my screen.
Everything looks perfect and sounds perfect.
Good. Okay. Well, I'm sorry that I wasn't able to join yesterday. There were a lot of interesting topics. I was at TLC PetSnip. We did a feral cat Saturday where Dr. Mallory Offner, good friend of mine, and I sterilized 64 feral cats. We had hoped to get 100, but we were only able to trap 64, but we did keep 37 kittens from coming into the world. This time of year is kitten season, and so I was busy doing that, and now sharing what I believe is an important relationship between TNVR programs and public health. Let me see if I can get my slides to advance. My little arrows are not working. Guess I'll have to use the little thing. I don't see the little thing down in the corner. Uh-oh. Oh, there we go. Okay. I'm sure after all these great discussions, and certainly Dr. Shepard did an outstanding job of framing the shelter neuter return to field concept, something that we're trying really hard here in Polk County, Florida, to get going. And one of the arguments that I use in discussing with stakeholders is this relationship between the benefits to public health in addition to animal welfare. And so everybody here is familiar with the term TNR, trap, neuter, return. I've been advocating for the term TNVR for several years. Why? Well, the V stands for Vaccinate, which emphasizes the public health aspect of TNVR programs, including, and most importantly, vaccinating for rabies as a means of protecting the health of the public. Incorporating the public health component of TNVR programs engages a whole new group of stakeholders, the public health community. And Dr. Shepard mentioned that in her presentation, how, public health folks in her area are concerned about, the health of the community. But by promoting the public health benefits of TNVR programs, we engage this whole separate group of stakeholders, the public health community, in addition to the animal welfare community, in support of the humane sterilization of community cats. We're all aware of the growing body of evidence indicating that TNR is not only effective at reducing community cat numbers, but that such reductions are sustainable over extended periods. Here's a really nice figure from a great paper recently published showing an 85% decline in the number of cats on the University of Central Florida campus as a result of a long-term TNVR program. In a study published in the Veterinary Journal in 2014, Levy et al. Reported that high-impact TNVR combined with the adoption of socialized cats and nuisance resolution counseling for residents is an effective tool for reducing shelter cat intake. As you can see from these graphs, the annual per capita community cat trap, neuter, vaccinate, return surgeries in the target area, A, increased significantly during the 2 study years, years 1 and 2. This was accompanied by a significant decrease in shelter cat intake and euthanasia. In the non-target area, B, annual TNVR surgeries remained at the baseline rate, and shelter cat intake and euthanasia did not change significantly. The per capita results are reported as cats per 1,000 residents, and the asterisk is interpreted as being statistically significant. There's a difference than the mean plus or minus 2 standard deviations of the 5 pre-treatment years. This is a diagram that my friend and colleague Peter Wolf uses to describe the relationship between animal welfare and public health. Historically, animal welfare and public health have often been in conflict, with life-saving efforts seen as compromising public health. However, there's a major shift now taking place. Today, many communities have adopted progressive policies and practices that effectively address both public health and animal welfare concerns. So who knows what a Venn diagram is? A Venn diagram uses overlapping circles to illustrate the similarities, differences, and relationships between concepts, ideas, categories, or groups. Similarities between groups are represented in the overlapping portions of the circle, while differences are represented in the non-overlapping portion of the circles. Here is one of my favorite Venn diagrams. This is based on the U2 song, With or Without You, where the lyrics say, with or without you, I can't live with or without you. So as you can see, the place where Bono can't live. I prefer to look at the relationship between animal welfare and public health in the context of a Venn diagram. Here you see that there are some overlaps between the 2 disciplines, notably rabies prevention and what we're going to talk about today, how TNVR can benefit both sides of our Venn diagram. Who amongst us knows what a slide rule is? I had a slide rule when I was in high school, senior in high school, and then my very next year, my freshman year in college, the pocket calculator came out. Imagine being the slide rule manufacturer the day the pocket calculator came out. I liken TNVR to the slide rule. It works, but something better will come along. But until that time, it is better than doing nothing. Now, what is that something better? Right now I'm on the board of directors of the Alliance for Contraception in Cats and Dogs, and there's a lot of work being done in the realm of non-surgical sterilization. So it is very, very likely that within the next 5, certainly 10 years, that we will have a non-surgical sterilant that will totally make spay-neuter surgery go the way of the slide rule. So stay tuned to that. So right now, TNVR is the best public policy for community cats. It reduces shelter intake and euthanasia. It reduces complaint calls to municipalities. It saves taxpayer money, and it's supported by 70% of the population. So why the focus on public health? Well, recent attacks on TNVR have focused on free-roaming cats being a threat to the public's health. There's a lot of misinformation out there. Probably the most notable attack on TNVR is the recently published book, Cat Wars: The Devastating Consequences of a Cuddly Killer. Oh my. According to Mara, who's been with the Smithsonian Institution's Conservation Biology Institute since 1999 and now runs its Migratory Bird Center, outdoor cats are, quote, unrelenting killers and cauldrons of disease, unquote, whose quote unquote devastating consequences must be dealt with by eradication in the name of biodiversity. Quote, from a conservation ecology standpoint, the most desirable solution seems clear. Remove all free-ranging cats from the landscape by any means necessary. Since when did killing one species in the name of another ever make any sense? Recently, opponents of TNVR programs have focused on two public health issues, rabies and toxoplasmosis, in their efforts to scare people regarding the apparent threats to these diseases posed by feral and free-roaming cats. We're going to discuss these two diseases today and demonstrate why TNVR programs actually protect people in their communities from these threats. Every year, the Centers for Disease Control and Prevention publishes rabies surveillance in the United States during the previous year. This comprehensive document lists numbers and percentages of wild and domestic animals diagnosed with rabies. It also gives guidance for what is considered exposure. The figures shown represent annual surveillance data from 2018, which is the latest year in which it's available. In 2018, there were 21,764 cats tested for rabies, of which 241, 1.1%, were confirmed rabid. This percentage has been pretty stable over the years, and as a matter of fact, the percentage of cats tested for rabies that were confirmed to be rabid in 2018, 1.1%, was similar to the mean percentage during the previous 5 years, which is 1.2%. And that 95% confidence interval ranges from 1.1 to 1.2%. So it's been stable. If you look at it over a period of time, it's been relatively stable. During 2018, antemortem samples from 23 human patients in 17 states and U.S. territories suspected to have rabies were submitted to the CDC for laboratory diagnostic testing, of which 3, 13%, were confirmed to be positive. Nowhere does it list a cat as a source of exposure for a person acquiring rabies during 2018, the latest year for which the data is available. As a matter of fact, rabies surveillance in the United States during 2006, published in the Journal of the American Veterinary Medical Association in 2007, says, quote, the last documented case of human rabies from exposure to a rabid cat was in 1975. So the same document shows the distribution of major rabies virus variants in the US and Puerto Rico during the period 2014 to 2018. You can see from this diagram, there are several major rabies virus variants, raccoon variant along the eastern seaboard, skunk, fox, mongoose. Here's a map showing cases of rabies in raccoons. And you can see where that kind of lines up with the previous slide, raccoon variant along the eastern seaboard. So this is 2018 reported cases of rabies in raccoons by county in 2018. Whoops, too many clicks, sorry. Same document, reported cases of rabies involving cats by county 2018. Now, let's look at them side by side. Do you notice anything? Most of the rabid cats were reported from states where the raccoon rabies virus variant was considered enzootic. So to reiterate, vaccinating for rabies as part of a TNVR program. This emphasizes the public health aspect of TNVR programs. Vaccinating against rabies is a means of protecting the health of the public. And vaccinating community cats creates a barrier to the disease between wildlife and domestic animals and people. An important concept to understand is herd immunity. We've all heard a lot about herd immunity with the COVID pandemic. Herd immunity is a form of indirect protection from infectious disease that occurs when a large percentage of the population has become immune to infection, thereby providing a measure of protection for individuals who are not immune. Individuals who are immune to a disease act as a barrier to the spread of disease, slowing or preventing the transmission of disease to others. This diagram illustrates how rabies could spread in a susceptible colony of feral cats if each infected animal were exposed to 2 other cats. It's a diagram that has been adapted from Jekyll's textbook of epidemiology, biostatistics, and preventative medicine. The blue dot represents an unvaccinated infected animal. The white dot represents a susceptible but uninfected animal. And the orange dot represents an immune cat who will not pass the infection to others. In the absence of herd immunity, the left diagram, the number of cases doubles with each disease generation. We see that in the presence of 50% herd immunity, the right side of the diagram, the number of cases, blue dots, remains constant. Now, I'm quite sure that many of you are in communities that have robust TNVR programs, but maybe your animal control isn't on board yet and doesn't believe in, say, return to field. And so they're not as enlightened as Dr. Shepard is and her organization. And so they get a nuisance call about some cats. And so they send an animal control officer out to trap a couple of these cats. What happens if 2 vaccinated cats, shown in orange, are trapped and removed and replaced with susceptible cats? So this diagram shows how trap and removal of previously vaccinated cats will actually increase the susceptible population of cats. If 2 vaccinated cats, orange dots, are trapped and removed and replaced with susceptible cats, then the number of rabid cats in the colony skyrockets. And there's published evidence in support of that. Fisher et al. Published an article in JAVMA entitled, quote, "Response of Feral Cats to Vaccination at the Time of Neutering," unquote. This article showed that prior to vaccination, some cats had protective serum antibodies, but only 3% of them had antibodies to rabies virus. Notably, following vaccination for rabies, 98% of the cats had protective serum antiviral antibody titers. Their conclusions were that feral cats appeared to have an excellent immune response following vaccination at the time of neutering, and that incorporation of vaccination into trap, neuter, return programs is likely to protect the health of individual cats and possibly reduce the disease burden in the community. They also concluded that vaccination of feral cats at the time of neutering may protect them for much of their remaining lifespan, because immunity that develops following vaccination has been shown to persist for a minimum of 3 to 7 years in most cats. Now, one of the things I was going to talk about, but I was afraid I wouldn't have enough time, was the difference between a 1-year licensed rabies vaccine and a 3-year licensed rabies vaccine. And it's kind of hard without diagrams to explain it, but the reality is the way a vaccine is licensed by the United States Department of Agriculture, it has to survive a challenge. Vaccinated animals have to survive a challenge to virulent disease organisms, and so, long story short, the 3-year vaccine has been shown to survive a challenge, at 3 years duration. So in my feral cat TNVR programs, always use a 3-year rabies vaccine, because the duration immunity, while it's not been shown, and the label says that the animal should receive a booster vaccine at a year, we know that these feral cats may not get that booster vaccine. So the immunity that the cat gets is likely to persist beyond that. But that is one caveat and a criticism that I have encountered by county commissioners, city commissioners. Well, the label says they need to be boosted in a year. How are you going to do that? I mean, that's one caveat. Ideally, cats should be retrapped, if possible, and boosted for rabies according to the guidelines established by the AAFP. Many states have laws regarding rabies vaccination, and as veterinarians, we cannot arbitrarily ignore or alter those. The vaccine recommendation for, feline panleukopenia, the FVRCP vaccine, says, an annual booster. Now, some of them now are coming out with a recommended 3-year booster. I've got a couple of really senior cats that are indoor only. I don't vaccinate them for FVRCP, because there's a significant amount of data that shows that after a couple of those vaccines at a young age, they're likely immune for life. I can make that, if I'm a practicing veterinarian, I can make that recommendation to my client. I can't do that with rabies. I can't say, oh, your cat doesn't need a rabies vaccine. Now, some municipalities and states allow for waivers, but the problem with a waiver is the cat's not protected, and if a bat gets into the house, for instance, it turns out to be rabid, then you got a problem. So because rabies is the vaccine is regulated by state law in many cases, not all states, but in many cases. We just, as veterinarians, can't arbitrarily ignore that. That said, I feel confident that if I give a feral cat a 3-year rabies vaccine, even though it would only be recognized for 1 year because it was his first vaccine, I feel confident that that animal is going to have protective immunity for a longer period of time. And this is why I'm advocating that all TNVR programs include the V. Not only are we preventing cats from reproducing, but we're building a barrier to a disease that will protect domestic animals and people. Another disease that Mara brings up is toxoplasmosis. Mara says in Cat Wars, quote, "It is becoming increasingly clear that toxoplasmosis is a significant zoonotic disease, perhaps one of the most significant, that impacts humans globally. And it emerges primarily from outdoor domestic cats," unquote. I mean, you'd think that that this is going to cause the end of the world. Well, let's look a little bit more closely at the organism and its life cycle. It's very complex, but the cat is the definitive host, and once the organism is shed in their feces for only a short time, according to Green's Infectious Diseases of Dog and Cat, 1 to 3 weeks. I've seen other references that say 1 week. I've seen other references that say 1 to 2 weeks. Green's is kind of like the infectious disease Bible. The point is, the organism is shed after they're exposed for only a short time, once in the cat's lifetime. Most cats are infected at a young age when they start to hunt and consume an infected rodent. Keep that in mind as we talk about how TNVR programs will help prevent the spread of toxoplasmosis. Mara would have you believe that cats are out there shedding toxo-organisms constantly, and as a result pose a threat to people and pets, which is why he's been quoted as saying that we need to, quote, "remove all free-ranging cats from the landscape by any means necessary," unquote. This isn't going to work, nor will it solve the problem of toxoplasmosis, nor is it humane. First of all, there's no way that we will ever remove all free-ranging cats. Think about this. Preventing kittens from being born will decrease the amount of T. gondii organisms in the environment because, and this is why TNVR programs are so effective at preventing toxoplasmosis. We sterilize community cats so these young cats are never born. Remember I said yesterday that we kept 37 feral kittens from being born. So by sterilizing these cats, these young cats are never born, and therefore they never start hunting, they never get infected, and they never shed the environment in the the organism in the environment. Green also makes some interesting summary points about toxoplasmosis. People get, the fear mongering about toxo is pretty incredible. And people are afraid that they're going to catch this from a cat, so they relinquish the cat to a shelter. And that's unnecessary. As long as good hygiene is practiced. Go down to the third bullet point. And this is from Green, but it's also all over the CDC website. Ingestion of undercooked meat or contamination of uncooked foods by cutting boards used to prepare raw meat is a common source of toxoplasma infection for humans. And again, I want to reiterate the middle bullet point. Most cats become infected from carnivorous behavior soon after weaning and shed oocysts for only short periods of time, under 3 weeks thereafter. So if we can prevent these young cats from being born, we prevent the shedding. But understand that even if a young cat is born, it's infected, it sheds for 3 weeks once in its lifetime. It's not like these cats are out there shedding toxo-organisms all over the place for the rest of their life. So again, by reducing the number of kittens born, we can help prevent the spread of toxoplasmosis in the environment. This is a textbook of entitled Handbook of Zoonosis Identification and Prevention, published in 2007 by Colville and Berryhill. I took a quote out of there. Quote, cats have gotten a bad rap about how they transmit toxoplasmosis to humans and how they cause spontaneous abortion in women and blindness and mental retardation in newborn and older children. While it is true that cats are the only definitive host for the infective stage of the toxoplasma organism, they are not the most common source of human infection. The most efficient way to get toxoplasmosis from a cat is to eat the cat undercooked. Unquote. That's from a textbook. I didn't make that up. And again, there's substantial scientific evidence that when properly applied, TNVR has been shown to help control and reduce the population of free-roaming cats. We all know this. I'm not telling y'all something that you don't already know. But what I am trying to get across is that we know that feral cats have an excellent immune response following vaccination at the time of neutering, and that incorporation of vaccination into trap neuter return programs is likely to protect the health of individual cats and possibly reduce the disease burden in the community. TNVR programs prevent the birth of kittens who, as they grow, start to prey on rodents, where they acquire the T. gondii organism. If these kittens are never born, they will never be able to shed the organism! Exclamation point. TNVR not only reduces reproduction, but also protects the health of the public. When I was at the University of Illinois, whenever I would lecture students, I'd like to finish my presentation with some words of wisdom. And I think this really, really applies to management, particularly humane management of feral and free-roaming cats. What we see depends mainly on what we look for. This is really so true when it comes to humane management of feral and free-roaming cats. Okay, I wanted to leave plenty of time for questions.
So one of the questions we have here is, does it make a difference at the age of the cat that we give the rabies vaccine to? Are there any differences in protection for 8-week vaccine, 12 or 16-week?
Well, the vaccine is licensed, and if you pull out the insert, it's licensed for cats 12 weeks of age and older. And one of the things that I wanted to do before I left Illinois was to actually vaccinate some 8-week-old kittens and look at their immune response. And we never got that project off the ground before I retired, which is a shame, because you can't, since the label says 12 weeks and older, if I vaccinate an 8-week-old kitten, I cannot legally issue a rabies certificate because it's outside the limits of the label. But we do it anyway, because we know that that's likely the only rabies vaccine that that cat may ever get. Now, is that cat protected? You know, we think they are, but there's really not a whole lot of evidence to support that. And I would like to see a study that documents the immune response. So my answer to that question is, legally can't give a certificate, but I still do it because I suspect that they're getting some protection.
Right.
But that's a really good question.
If you were an animal control officer, or you lived in that sphere, how would you basically take what you just presented to us and present that to the town followers? I mean, I know actually in your location where you've been, you've had some challenges around getting supporters for TNVR at the public level. So, how have you faced those challenges, and how can others face maybe some of those challenges either from the inside or from the outside?
Unfortunately, in our county, Polk County, Florida, animal control is under the purview of the sheriff's department. And our sheriff, who is incredibly popular, you may have seen him on national TV. He's been on national TV several times advocating. Back when there was a lot of civil unrest, he was quoted as saying that Polk County people are very fond of their guns, and I'm encouraging someone kicks in their front door to blow them back out the door. Well, that made national news. He's a really good guy, but he's also an avid bird photographer, and he is worried that returning these cats to the environment is going to be bad for the wildlife population. And I've tried to make it clear that by sterilizing these cats, we're preventing fewer cats from being born to prey on the bird population. But so far, I have not personally spoken with him. I've spoken with some of the underlings, and their response was, and this was a direct quote, one of a major in the sheriff's department, after I did a presentation similar to this, showing the benefits, and they asked me, do all animal welfare organizations support TNVR? And I said, well, the major progressive ones do. And he said, well, we found a couple that didn't. And I said, really? What were those? He said, PETA and the American Bird Conservancy. And my response was, well, I don't think those are generally considered mainstream animal welfare organizations. But I mean, they said, well, we did our homework too. And so it's really hard you can lay out the evidence. And, as I did showing in Julie's paper and the other paper showing the decrease in population, and talk about things like herd immunity and how we can, by reducing the number of kittens, we can reduce the spread of toxoplasmosis. But at the end of the day, that quote at the very end of my presentation, what we see depends mainly on what we look for. And until our avid bird photographing sheriff comes to realize that TNVR and return to field programs reduce the number of kittens that are being born in a community, it's an uphill battle, no doubt.
It's funny because we have so many, the organization I used to run, I'd say 50% of our volunteers and staff members are avid birders, but yet they are, very strong supporters of TNVR. One question came in that there is a person who has some veterinarians who will, when they're doing spay neuter, they're not required to give a rabies vaccine. And so but they ear tip them, and they have asked that they not ear tip them if they're not rabies vaccinated. So anyway, how do you think, how can you convince a veterinarian to give them the rabies vaccine, so, along with the ear tip?
What's the reason for not giving the rabies vaccine? Do we know?
I will, if that person can respond in the chat, I will pick that up as to why they wouldn't. I know.
As a veterinarian, I cannot see a reason for declining to give a rabies vaccine, particularly those slides I showed of the raccoon cases in the Northeast and the cat cases in the Northeast. If you're in an area where rabies is not endemic, you could say, well, it's not really a threat, but still you don't know, because rabies started out on the eastern seaboard, up in the Northeast, and look where it's all along the eastern seaboard now, and it does spread. So I cannot see a justifiable reason for not giving a feral cat a rabies vaccine at the time of sterilization. Now, the ear tip, what are we signifying with an ear tip? Are we signifying that they've been sterilized, or are we signifying that they've been vaccinated for rabies? My feeling and understanding is we're signifying they've been sterilized. If we trap a cat with a tipped ear and it's brought in, we notice it's got a tipped ear, we'll give it a booster rabies vaccine, just in case. Now, when I was at Illinois, we had a pilot program going that was funded by Alley Cat Allies, where we started microchipping all feral cats so that we would have a record and we would know precisely when that cat had a rabies vaccine. So if it was retrapped, we could booster it and have a record of that. Yeah, that added about $5 to the cost of each sterilization, because we were using the Found Animals Foundation microchips, which are like $5 a piece, $4.95, I think. But that way we had a record. It's not like, well, I think it was that black cat over there. That when it comes to rabies exposure, that doesn't cut it. So, we, like I said, now at TLC PetSnip, we get one in with a tipped ear, we booster it. Now, here's another thing to think about. I mentioned the work that's being done to develop a non-surgical sterilant. How are we going to identify cats that have been treated with this, because they won't require general anesthesia to be given an injection? So if they're not anesthetized, you can't cut their ear off. Right. So ACC&D is working on that. We've got a marking project going where we're looking at ways to identify cats that have been non-surgically sterilized. And ideally, in a perfect world, we'd be able to tell, what year it was done and what year they had a rabies vaccine. So stay tuned. That might be subject for another podcast in coming years to talk about how those things are changing.
Right. I mean, I can see the microchip carrying the surgical injection information, as well as the rabies vaccination information or something like that. That would be connected to the microchip information.
But yeah, the project we're working on is not talking about a microchip. So it's okay.
Well, I don't know. You can share what you want. I just,
Yeah, it's a way to
work in progress.
Externally recognize, from a distance, that an animal has been sterilized. So.
So Joy just clarified in her question. It's the rabies vaccine is an add-on, and so it's a cost issue. So it's not for like when they use the veterinarian, they require the rabies vaccine for their TNVR cats, but sort of, I guess, when the general public comes in, it's an extra $15. And so if the public is just trying to get to the basic sterilization part of things, or spay neuter, they don't add on that extra $15.
Yeah, but it only costs $2 for a rabies vaccine. So a All right, inflation maybe 3 now. It's been a while since I've bought rabies vaccine. The point is, rabies vaccine is not that expensive. And because we're talking about a uniformly fatal zoonotic disease, in my professional opinion, it should not be an add-on. It should be a requisite part of a TNVR program, unless you live in Hawaii where there's no rabies.
Right.
But if you live anywhere else, where there is rabies, particularly, bat rabies, which you may not be aware of, or other terrestrial types of rabies, it should not be optional. And it only costs $2 or $3 to add that on. So.
In reality, what are your thoughts about testing for feline leukemia and FIV?
Oh gosh, I've actually had some discussion with Julie Levy about this, and the latest, AAFP recommendations have come out, and I try reading that stuff, and my head spins. I'm assuming that this question is being asked in the context of TNVR programs, and I'm going to answer it that way. I think it's a waste of resources to test, and here's why. Particularly, these small ones we get, this time of year, a little bit later in the year, we get the 2 to 3 pounders. If the FIV test is an antibody test, so they could potentially have gotten antibodies from the mother, so you're going to get a false positive. FELV can be a transient infection from the mother and then go away. So I guess my question to the questioner would be, what are you going to do with those results? The old adage, be careful what you look for, you might find it. You start testing for FELV, FIV, you get a little 3-pound kitten that's FIV positive. Are you going to euthanize it on a test that has a high percentage of false positives because it's an antibody test, particularly in that age group? FELV, if it's positive, could it be a transient infection? The cat will get rid of it. One in 3 cats will fight it off, get rid of it. 1 in 3 cats will always have the virus in their system, but never really get sick from it. And then 1 in 3 cats may eventually have problems with it down the road. So what are you going to do once you get that information? And we know that FIV in particular, we see a fair number of the bigger jowly tomcats that have, old bite wounds and new bite wounds. We see them being FIV positive, but you're sterilizing them, so they're not going to be fighting anymore, and likelihood of them spreading it then decreases significantly. Are you going to euthanize based on one test? Then, or are you going to spend the resources for a confirmatory test, like Western blot in the case of FIV or PCR in the case of FELV? Those are not inexpensive tests. So I personally don't recommend it.
Very good. Very good. All right. So question with regards to birds. Is there evidence that managed colonies with well-fed cats kill fewer birds?
Yes, there is. Julie Levy published a paper several years ago that showed they did scat analysis on managed versus unmanaged colonies, and there was less bird DNA in the managed colony. And you think about it, you get old tomcat, he's been neutered, he's provided resources, nice sunny day. What's he going to do? He's going to eat. He's going to go take a nap. That's not to say that even in managed colonies there isn't some predation going on, but I believe that this paper showed that there was less bird DNA in managed colonies compared to non-managed colonies, which to me is a great argument with our sheriff. Look, we're talking about returning these cats to a managed colony, and I saw something on Facebook the other day. This was interesting. So we're talking about using tortillas instead of paper plates to feed cats. And I wrote in, I said, guys, this is not a good idea because, you know, you're going to attract nuisance wildlife because you're just going to leave them there. And they said one of the great things about it was, you know, the raccoons will come and clean up the tortillas. Well, I don't think we want raccoons coming and cleaning up the tortillas, because that's one of the complaints against feeding, is that it attracts nuisance wildlife. So, you know, I think we got to be smart about how we do this. I think managed colonies, the health and welfare of the animals are better off. I think there is evidence to show there's less predation, but let's not do things that are going to make matters worse by attracting nuisance wildlife.
Right. Yeah, I saw that too. And I mean, I understand there are a lot of overwhelmed cat loving folks out there who are going from colony to colony to colony,
Right.
and they're feeding. They can't, you know, come back half an hour later to pick up, or their feeding is irregular. And, you know, there are best practices when it comes to the management of colonies, and just throwing food out on the ground next to a dumpster is not the ideal way to take care of a colony of cats. And you're actually potentially putting those cats at greater risk for being called a nuisance, because you're actually drawing them to an area where they're going to be seen and heard, and, you know, teaching them a behavior that's not good for the general public.
Well, and also attracting nuisance wildlife. If you're in an area in the northeastern United States where raccoon rabies is endemic, and you attract some raccoons, and you happen to attract a rabid raccoon, and, you know, people witness cats and the raccoons fighting or whatever, then now you've got a public health issue. And if you can't document that animal has had a prior rabies vaccine, again, oh yeah, I think we vaccinated that gray cat. Well, that's not considered documentation. Then, you know, the animal will likely have to be euthanized. So there are unintended consequences of, you know, these things. And I respect what you're saying, that there are a lot of overworked, you know, colony caretakers.
Right. But that's why we're here. You know, we're here to bring more people into the room so people can get support and the help. I mean, I've talked to quite a few people who are like, well, it used to be 4 of us and now it's just me, and I'm feeding 200 cats, you know, on a daily basis. And so we need to bring more people out helping their community cats. We've had a couple of follow-up comments with regards to the FIV, feline leukemia testing. I'm going to put a shout out here. In July, we're going to be doing a feline leukemia day. Dr. Levy's going to be part of that. And so I want folks to really tune into that to find out about the intricacies about testing and doing adoptions for feline leukemia and FIV positive cats. That whole world has changed dramatically in the last, 2 to 3 years in many parts of the country. The thoughts about, FIV positive cats and feline leukemia positive cats can easily be adopted out and have healthy and good lives. And so we have a lot of information. If you're really eager, we also have the recordings from last year's feline leukemia day. So I recommend you check all of that out. There's some really, really tremendously great information, and you can always email me and I can put you in touch with a lot of people who know more about it than I do. But I think that from a standpoint of a community cat conversation and where the resources are best spent, it's much more focused on spay, neuter, and getting the vaccines done. And one of the things I had done at one point in time too was I would go to the Massachusetts Board of Health Association's conferences, and I did some tabling there to reach out to all of we have health inspectors as well as animal control officers, and sometimes they're the same person and sometimes they're different people. So to try and just get the word out, and Board of Health. I mean, it got to the point where I actually had a community head of a Board of Health call me up and say, can we have your mobile spay neuter clinic in our town, because we have such a problem with community cats. And so it was wonderful to have an invitation from a public health department to have us come, and they actually had our community cats. We would hold them in a bay at the fire department. So they'd pull out their fire truck and give us a bay, and they'd heat it up for us, and when we'd use it for holding and recovery. And so it was a real community project. And that's the kind of stuff I love to see happening, you know, all around the country, is that real partnership with public services. And the fire department people said, the firefighters, they said, we want to help you because when we go to these houses with fires, with, you know, issues, you know, we see it all. So, you know, we don't want to see a house with 50 cats in the backyard, you know, that kind of thing. So anything they can do to prevent it gives them a resource. Let me just see if there are any other questions. Here's a quick follow-up question. Was it FIV or feline leukemia that 1 in 3 cats who have it will clear it or not get ill from it? It was feline leukemia, you said, right? Or was it FIV?
No, leukemia is 1 in 3 will clear it. 1 in 3 will always have it but never get sick. I mean, these are real vague generalities. And 1 in 3 will have it and then will ultimately get sick from it. Now that's, you know, like I said, I talked with Julie the other day about this, and you know, those recommendations, they're relabeling things, you know, abortive infections, regressive infections, and whatnot. And that's not my area of expertise. But again, there's a lot of new information out there, and particularly, like you said, with respect to adopting, you know, these cats, and my opinion is that the benefit of testing as part of a TNVR program is just does not support the use of resources.
Yeah, I always use the example. If you have like 10 cats and you have $10 like per cat, and it's $10 a test or $10 a surgery, and you want to get that colony under control and you only have $100, you know, how are you going to spend it? I've used this conversation with a lot of veterinarians who had questioned testing back in the day. And they were like, well, of course, I'm going to spend the $10 and I'm going to get the 10 cats done and spayed and neutered. And they said that, but that's only if your resources were limited. And I'm like, yeah, but my resources are limited, you know? Yeah. And so it was sort of like, oh, really? Okay. So it's just trying to share the conversation and perspective and understanding where we all are with our, you know, with, in many cases, our very small budgets, and picking and prioritizing, and then, you know, sort of trying to have folks on the other side understand, you know, where we're coming from too, which is what's going to be the biggest bang for your buck. Anything else, Dr. Weedon, you'd like to share with the group before we close out?
No, just other than that, you know, for years and years, we've been appealing to, you know, the animal welfare community to help the animals, and you know, as Dr. Shepard said, sometimes, you know, when you're dealing with municipalities, they have limited resources, and while they genuinely want to help the animals, if you can appeal to the public health side, hey, we're not only helping these animals, but we're protecting domestic animals and potentially people from the threat of a uniformly fatal zoonotic disease, then you get the attention of a different group of stakeholders and get more support on board. And I've talked to innumerable county and city commissioners about this, when, you know, talking about, well, what about, you know, toxoplasmosis? People worried about that. And you show them the evidence. Look, it's the young kittens that are spreading this. If we sterilize these animals, you're not going to have those young kittens. It's not like every cat that's out there is willy-nilly spreading toxo. And if they start to understand, then they realize, okay, if we sterilize these animals, we can potentially reduce the threat of exposure in the environment. So.
Yeah, and I also will say, once you do get friendly with your Board of Health and you come on board as saying, you know, I'm here to reduce your cat population, the next question out of their mouths to you is how to solve the rat overpopulation problem. I have gotten that question many times. So it's just beware and get to, and I think the ACC&D might have some information about rat information too.
There's actually some work being done in a non-surgical, rather than killing, you know, with the warfarin type or other types of rodenticides, a sterilant that keeps them from reproducing. So yeah.
Yeah. So just forewarning yourself, once you get looked at as a resource, you'll be asked about other species questions. Once you'll be known as the animal person, not necessarily just the cat person. So you might want to educate yourselves on rabbits and dogs and and
You know,
rats.
one thing you can say, Stacy, if you look at the explosion of working cat programs, you know, that like there's a brewery in Chicago that's got, you know, half a dozen feral cats that live in the brewery, and guess what? They don't have a rat problem anymore.
Right.
So,
Right. No, and
right.
it's definitely, it's true. I had the situation happen in Chelsea, Massachusetts, where they had dug up a whole situation to build a brand new FBI complex. You know, so of course all the homes of the rats got dislodged, and so like they just moved into the areas where folks were living, and so it was a displacement type situation where they ended up having to move to another area, which is unfortunate. So then there was a clashing going on, but I think the city is addressing that issue. But just to be forewarned, once you make these partnerships, they will look at you like a resource and
Sure.
try to make sure you're as prepared as possible.
Yeah.
All right, so we are at 2 o'clock, and we're going to do a bit of